So starting with anatomy, I just wanted to talk about the stomach regions and some of the other anatomical landmarks. We'll start with the regions. So the cardia is the region of the stomach that's closest to the esophagus. It's located here. And a good mnemonic to remember that is, I remember cardia burn is heartburn. So, and we know that heartburn affects our esophagus. So it's an easy way to remember that your cardia is the closest region. The next region is the fundus. That's the highest region of the stomach, located here on the right. And I remember that by thinking fun in the sun. Our body is the largest middle portion of the stomach, so it comprises this entire area. And our pylorus is the region that's closest to the duodenum, so it's located here. And you can subdivide the pylorus into two sections. There's the pyloric antrum, which is the section closest to the stomach. And you have the pyloric canal, which is closest to the duodenum. And I remember the difference between the two. I always think of the A in antrum as the first letter of the alphabet. So it's going to be the first thing that food encounters between these two regions. And now talking quickly about sphincters and curvatures. The lower esophageal sphincter, which we discussed in great detail in the esophagus lecture, divides our stomach and esophagus. So it's located up here. Whereas the pyloric sphincter divides our stomach and our duodenum, which is located here. The stomach has two curvatures. We have a lesser curvature, which is located here, and the greater curvature is the larger of the two curves, so it's located all the way around here. Now I'd like to take some time to talk about blood supply. I think this can be high yield. A lot of times test takers don't know how to test anatomy in a lot of different ways, so they tend to rely on some blood vessels, especially these that I'm about to go over. So we've talked about this before, but as a reminder, all of our four gut organs receive blood supply through the celiac trunk. And the celiac trunk, which I've kind of alluded to, but haven't discussed in great detail, the celiac trunk is comprised of three major vessels, okay? And let's talk about those right now. We have our left gastric artery, which I've highlighted in orange. We have our common hepatic artery, which I've highlighted, including all of its some of its branches. We also have the splenic artery, highlighted in purple. And as you can see, the combination of these three vessels are able to adequately supply many regions of the stomach. Now I want to take a step back and ascertain exactly which blood vessels are contributing to each region of the stomach. So for the cardia, remember cardia is the region closest to our esophagus. That's going to be supplied by the left gastric artery. The fundus, on the other hand, is going to be supplied by the short gastric arteries coming off of the splenic. So here's our splenic artery. And from that splenic artery, you can see these branches right here, the short gastrics, to supply the fundus. The lesser curvature is supplied by two different arteries. We have our left gastric, and we also can supply it through the common hepatic, then that goes to the proper hepatic, and that'll lead to the right gastric artery. The greater curvature can also be supplied by two different arteries. First, starting with the splenic artery, the left gastroepiploic artery, sometimes called the left gastroomental artery. And it can also be supplied through the common hepatic and the gastroduodenal artery, leading into the right gastroepiploic artery. Now, why is this clinically relevant? Well, this is clinically relevant because the lesser and greater curvatures, at least most of the lesser and greater curvatures, are able to receive collateral circulation. So if one side goes bad, there's a reduced risk of ischemia because another blood vessel can just help out and provide some collateral flow so the tissue doesn't die. So let's talk about how that works. And this is basically what I just said, is that there's dual supplies, and so there's less risk of ischemia. So for the lesser curvature, if we think about our left gastric coming into here, imagine that you have some sort of event causing obstruction at that X. Normally, we'd be worried about the region of tissue distal to this obstruction. But because there's collateral flow, this blood can come here and it can even bypass it and go a little bit further to help out. And so you're not going to get as much ischemia in that region. And you can see the same thing if you have an obstruction in the blue in the right gastric artery, then the left gastric can help out. And the same thing goes for most of the greater curvature, right? At least the more inferior portions of the greater curvature of the stomach. You can imagine that if there's a mark here in the left gastroepiploic, then the right gastroepiploic can help out. And likewise, if the right gastroepiploic or the right gastroomental artery has some obstruction, then the left gastroomental can help out. So everything has dual blood supply, almost. I really want to talk about a couple test taking tips. So you need to know the anastomoses that I just discussed, because they can ask something like, the left gastric artery is critically stenotic, but the lesser curvature is well perfused. Which artery helps to supply this region? So they want you to realize that here's the left gastric, and they really want you to understand it, common hepatic to proper hepatic to right gastric. That helps out that region. And sometimes they'll test you which primary branch of the celiac trunk is helping, for which you'd answer common hepatic. But other times, if they don't specify, oftentimes they want you to know the specific artery, the closest artery. So in that case, you'd pick the right gastric artery because it's the one that's directly supplying that ischemic region. Another thing they like to test is the fact that the fundus is the most at risk for ischemia because there is not a lack of collateral blood circulation. As we've talked about, the lesser curvature is covered with the left gastric and the right gastric helping each other out. And the inferior portion of the stomach is covered by the right and left gastroomental or gastroepiploic arteries. But the right up here, the top right or the top left region, technically, of the stomach, the fundus, has a little bit of problem with that. So if you imagine the splenic artery being obstructed, they might say, which region is most at risk? So let's draw our splenic artery. You can imagine if this is cut here, if we can still have collateral circulation that kind of supplies most of this region, but it will not supply this region. It can't make it all the way up to the short gastrics up there. And so the fundus will be most at risk. And another tie-in I want to mention that we've talked about before in the esophagus lecture is that you need to know a couple of the common arteries that are responsible for bleeding in certain conditions. So the left gastric artery has two conditions you need to be aware of. First, Mallory-Weiss syndrome can cause bleeding from the left gastric artery, and gastric ulcers also tend to cause bleeding when they do bleed. It's from the left gastric. So if you imagine an ulcer right here, that can cause some bleeding. Another artery you have to be aware of is the gastroduodenal artery, which is located here, merging into the right gastroepiploic. And this artery is dangerous because posterior duodenal ulcers can bleed and cause life-threatening hemorrhage. So if you imagine a posterior duodenal ulcer, that could also bleed. Now for the stomach, we do need to talk about several cell types. There's 5 cell types that are going to be important for you to recognize. And I have some pretty useful mnemonics to help you. So here's the 5 cell types. Let's go in these in order. Our parietal cells are located in the body and the fundus. Just for what it's worth, I don't think the locations of these cells are as important as the functionality. You will need to know the location on a histologic slide, which I'll go over later, but I just wanted to be comprehensive. So the parietal cells basically located in a significant portion of your stomach, and their function is to secrete HCl and intrinsic factor. And my mnemonic for parietal cells is that they're very parite, like polite. And I say this because there's 2 reasons why I have this mnemonic. First off, they like to say hi. They're very polite, so they always say hi. And that reminds me that the 2 compounds that parietal cells secrete are HCl and intrinsic factor. And later, when we talk about histologic slides, we'll notice that they're the first glandular cell. They're in the upper glandular layer. So they're very polite because they're the first gland to greet anything that's coming into the system. Let's talk about chief cells now. They're also located in the body of the fundus. And the chief cell's function is to secrete pepsinogen and gastric lipase, which are both helpful for enzymatic breakdown. And so I think of chief cells as our chomp cells because they break down stuff. And our mucus cells are pretty easy to understand. They're located throughout the stomach. And as you'd expect, they would produce mucus and they also produce bicarb. So they basically counteract the acidic environment that our body tends to produce in our stomach. I don't have a mnemonic for that because that's pretty self-explanatory. Next, we have our G cells, which are located a little bit more distally in the pyloric antrum and then throughout the duodenum. And our G cells are responsible for secreting gastrin. And I remember our G cells are gas cells because of gastrin. And we'll find out that gastrin is the gas pedal for our stomach. It can help us produce a lot of hydrogen ions and make it a more acidic environment. So that's why the G cells I consider are gas cells. The last cell I want to talk about are D cells. They're also located pretty distal in the pyloric canal and throughout the duodenum. And these cells secrete somatostatin. And I always remember somatostatin as somatostopin because it turns off everything, okay? And so my D cells are decreased cells because they produce this hormone that basically shuts every other hormone down. We're going to spend quite a bit of time on the histology in the stomach. This might be the longest histology section I have for you because they do test this. So as a reminder, I know you've seen this probably far too many times, but the GI tract has 4 layers. We have the lumen, the mucosa, the submucosa, a muscular layer, and the serosa or adventitia. In this case, if we're talking about the stomach, it's a sliding organ, so it's going to be a serosa. And so remember that mucosa is also divided into 3 different layers. We have the surface epithelium, the lamina propria, and the muscularis mucosa. And in the case of the stomach, the surface epithelium is made of simple columnar epithelia with mucus cells. And so that's secreting our mucus and bicarb. And in the case of the stomach, the lamina propria is secreting a lot of the glands. So all those cells we just described are part of glands. So, and they have these cells in them. So our parietal cells are secreting our HCl and intrinsic factor. Our chief cells are producing our enzyme, our enzyme that help break down foods. Our G cells are producing gastrin, and our D cells are producing somatostatin. So let's look at it from this perspective. This, we can only see the mucosa and submucosa, but we have our lumen, our mucosa, and our submucosa. And then if we subdivide that, we have our surface epithelium. Here's our lamina propria, and then we have our muscularis mucosa right here. And now looking into the surface epithelium with a really fine tooth comb, you can see simple columnar epithelium. So they would look like this. And our lamina propria, as we just talked about, this is the area of our cell, our stomach that has a lot of the glands. So it's all those glands that we've talked about all live in here, all these different cell types. And now if we talk about how these glands actually secrete their substances into the lumen of the stomach, we have these things called gastric pits. And these are indentations that allow these glands to secrete substances. So I'll draw some in. Because it's a cross-section at a weird angle, some of them don't go all the way through, but just keep in mind that all of these, at whatever angle they're going, they do reach from the lumen down through the lower glandular layer. So they span across the lamina propria. And different sections of the gastric pits have different cell types. And keep in mind, different sections of the stomach also have different cell types. So this is not a one-size-fits-all thing, but it's a good idea to realize. So from top to bottom, let's talk about where these cells are, generally speaking. So at the very top in our surface epithelial layer, we usually have our mucus cells. That's our surface mucus cells and our mucus neck cells. In the upper glandular layer, we have our parietal cells. And then our lower glandular layer, we're going to have our chief cells, our G cells, and our D cells. So now what I want to do is I want to draw this gastric pit to the left here. And I want to talk about every cell so you can see it in a visual form. I've subdivided the slide now into a surface epithelial layer on top, as you can see here. And if you noticed, I cut the lamina propria in half now. And I did that because I wanted to let you know that there's two different layers of that lamina propria. We have our upper glandular layer, which is located here, and you can kind of see it has a more of a pink hue to it. And then we have a lower glandular layer, which is located here, and it has more of a purple hue to it. So here's the 6 cell types that we're going to go over, and we'll start in the surface epithelium and talk about the surface mucus cells and the mucous neck cells. These are pretty basic cells. They produce mucus and bicarb. Nothing to be surprised about with that one. The parietal cells produce, we already talked about this before, but they produce HCl and intrinsic factor. And here's where the mnemonic comes in handy. So just remember that parietal cells are very polite. They're very polite. They're the first gland to greet you. And notice how they're in the upper glandular layer. And they always say hi. And that's to remember HCl and intrinsic factor. Moving down to the lower glandular layer, we have several cell types. We have chief cells, G cells, and D cells. And so as we talked about before, chief cells, those are our CHOMP cells that produce pepsinogen and gastric lipase. G cells turn on the gas, so they produce gastrin. And D cells produce somatostatin, which is, I like to refer to it as somatostopin because it decreases the secretion of other hormones. Thanks for watching. I hope you enjoyed the video. Please like, comment, and subscribe for more content.